Oh, hello there. This is Mark Gittleman, speech-language pathologist, and many of you know that I go out on walks every day, and it's been a little while since I've made a video, but I wanted to make a video today about a concept that many of you will be interested in. It's called practice. And you might say to me, Mark, what do you mean practice? Well, practice is a really important word. And it's especially important in terms of those who have speaking difficulties, in addition to not only those with speaking difficulties, but to the therapists who are out there who are trying to help people with aphasia or apraxia speak. And practice means to think about a discipline that you want to learn, and you go about doing it, and as you do it, you learn about how to do it and do it correctly. Now, I remember I was in Midland, Texas, and I wanted to learn how to make guacamole, okay? Because I love guacamole, and decided that I was going to learn how to make guacamole at home. And so it took me, it took me a couple of years to figure out the best guacamole that I liked. And that might be the same way with you. Maybe there's something that you've learned in the past or something that you've tried to master. I know a lot of people work on their golf game. I don't particularly play, but many people do. And it's a lifelong commitment to a particular discipline. And you don't become a great cooker or guacamole maker or golfer or tennis player or chef or any of those things unless you practice it. And so this video is about two different things. It's about those with aphasia practicing what it requires to talk better. And it's about therapists who are learning how to help people with apraxia and aphasia speak better. Now, for both of those people, for therapists as well as for the people with the apraxia and the aphasia, it takes a lot of practice. I'll tell you, and I've got to be honest with you, I've been practicing 46 years of helping people with apraxia and aphasia. And maybe the first 10, 15 years, I kept on practicing. I'd practice one thing, and then there are things about it I didn't like. I kept on changing it. I kept going to seminars. I kept on learning what other people were doing. Didn't like that. Just kept on putting my own spin on it. Now, my wife Malka, she can't tell you how she cooks, but she's a wonderful cooker. I mean, she makes wonderful dishes. And after a while, you develop a sense. You just develop a sense of how to do it. And one of the problems for those with aphasia, as well as therapists in general, is that it takes a long time to figure out the best approaches to particular speaking difficulties because they require practice. They require practice. And that's what it requires. And so there are a lot of therapists out there who it takes them as long to learn the best ways to treat a particular problem as it takes sometimes the person with the problem to get better. So it's a street that we both walk on. Those of you who have apraxia, those of you who have aphasia, those of you who are caregivers, you've got the challenge of being able to practice what the therapist gives you and develop and get good at it. But you also have to have a therapist who knows what they're doing, who has practiced, who knows the ins and outs, knows the procedures, and doesn't just plop you down in front of an iPad or an augmentative communication device. That, to me, is profane, because many people who are being given these devices can talk. However, people are trying to take shortcuts, and shortcuts don't work. And most people with aphasia don't like the talking machines. They don't want to have a machine talk for them. And gosh, there's so many examples I can share with you of people who have developed the ability to speak and speak again. Do they speak perfectly? No. Do they speak functionally? Yes. What is it, Mark, when you say speaking functionally? Well, when I say speaking functionally, I mean if they can speak so they can function in the world. So they can go to a drugstore and order their prescription, or order in a restaurant, or have simple conversations at home. Can they recite the Gettysburg Address? Well, I haven't had many people who could do that. I don't think I can even do that. But but the concept is here that practice makes perfect. And you got to remember that if you have a therapist, it takes 10, 15 years for a good therapist to really develop an expertise. And it may take you a while, too, to develop and feel real comfortable with methods to help your loved one talk. Now, to complete this, I'm a speech pathologist. I've been doing this 46 years, and I can honestly say with complete truth that I'm still practicing. And that means that each and every day that I work with people, and I do work with people each and every day, I get better and better, even after 46 years. Okay? So, so that's what practice is all about. And many of you know that, who cook or play golf, or who play cards or bridge, or people who, do any particular discipline at all, that with time you get better. Now, I'm offering a seminar in Las Vegas in February, and you're going to learn the methods that I've learned through 46 years of practice. And most of the people I work with are talking with clarity. And so if you have a loved one who needs to speak again or speak with clarity, you're going to want to take advantage of that seminar. You're going to want to make the investment. You're going to make the investment in your loved one's ability to speak, because it's hell, and I never use, but it's hell for anyone who can't speak. I mean, let's face it. Let's be real here. And learning to speak is one of the most wonderful things that can happen for an individual who's got aphasia or apraxia, and maybe has been to 2, 3, 4 therapists and nobody knows what the heck to do with them. And many of them are being told, well, there's nothing we can do for you. Well, that's because they haven't practiced long enough. That means that they haven't committed themselves to maybe practicing long enough. Or maybe they're just inexperienced. But don't let inexperience affect your belief as to whether or not your loved one can speak better. Because whether or not your loved one has had success with therapy is not necessarily related to your loved one. Just know it may be related to the fact that the person who's practicing speech pathology hasn't quite learned the recipe yet. Kind of like me with the guacamole, okay? And just know, too, that it took me a long time of practicing with people, 10, 15 years, maybe even 20 years before I got really good at it, And just about anybody will tell you the same thing who has learned a discipline, a skill that is complex. So this is Mark Edelman, speech-language pathologist. I'm wishing you a good year this year. I'm wishing you the opportunity, and I'm going to make a request of you to make the opportunity to come to Las Vegas February 4th, 5th, and 6th to the Apraxia seminar, and then we have another seminar the following month in Aphasia. So if you really want to learn from an expert, if you really want to start making some progress, because, many of the people who I see have said, well, they've been to so many therapists and blah, 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 and nobody can help them, and doctors are telling them they can't talk, and therapists are telling them they can't talk, and therapists are telling them they need to buy or get a $7,000 speaking device that they hate using and sometimes ends up collecting dust in the closet. You don't want to go after that. You want to learn how to help your loved ones speak better. And, when you speak with them all day long, you can be stimulating their speech, helping them speak better. Even if it's just saying, can I have a cup of coffee? So that's my message to you. Down below this video is a bunch of information. One document is about the seminar coming up. And another document is making sure that you're on our mailing list. And another link is to our Facebook page. So you got a lot of stuff underneath below to check out, okay? And when you check it out, let's get into conversation. Let's get into conversation so that we can help you. And if you can't get to Las Vegas for any reason, contact me anyway. There's also a link with a questionnaire. So if you want to maybe consider online mentoring, which some people do, because let's face it, some people can't travel. Some people have those kinds of challenges. So if you have that kind of challenge, then there's a questionnaire link underneath this video. Fill that out, send it to me, and we'll arrange for a free phone call. And then we'll decide if your loved one would be a good candidate for the teaching of talking method and whether or not you would be interested in coming online with me and learning this stuff. Now, I had learning disability when I was a kid. I had learning problems. Man, I had major learning problems. So that's the reason. One of the reasons why we're as successful as we are is because I know how to break it down. I know how to break it down in tiny little chunks so people learn. Most people who are, real smart, they say, well, you got to do this, and then do this, and then do this, and then do this, and then do this. See ya. That's how they learn. They learn real fast. But some of us, especially those with apraxia and aphasia, we don't learn that way. And for a lot of therapists, that's the only way they know how to teach, is how they learn. And that doesn't work either. So I've learned and developed methods that are very simple, that anybody can learn. I've taught people who haven't even had high school educations how to help their loved ones speak. And I can put them up against just about anybody in terms of their ability to stimulate speech and language. Okay, so the garbage truck is coming. And I'd throw all that other stuff in the garbage and learn the teaching of talking so that you can have fun, help your loved ones speak better, and be happier in this coming year. So this is Mark Idelman signing off here. Don't forget, if you like this video, give us a thumbs up. Make sure you read the document. There's a link there to the meeting in Las Vegas where I'll work with you intensively. I'm only taking 10 people, 10 couples, and I'm going to work with each one of you and develop a plan for you and start teaching you exactly what to do so that when you leave the seminar, you'll feel confident knowing what to do and knowing what to pursue. And we're also writing a book. It's a new book, The Teaching a Talking Approach to Apraxia of Speech. And you'll be interested in that. And each participant who attends in Las Vegas will get the Teaching of Talking Approach to Apraxia. And if you also take the Aphasia course, you'll also get the book, The Teaching of Talking Approach to Aphasia, and you'll get the video, The Teaching of Talking Approach to Aphasia. We haven't done then yet the video for apraxia, but we're probably going to have the seminar videotaped. A lot of people have been asking about that. So it's been great. I'm back home now. I got to get to work. I got patients to see. So it's been great having this time with you, and I'll see you in Las Vegas, okay? All right, bye-bye now.